Infection during pregnancy or following childbirth or abortion is a significant cause of maternal morbidity and mortality. The availability and correct administration of parental antibiotics is extremely important and can save lives. Medical Aid Films has made this film to explain the use of parental antibiotics in pregnancy, after childbirth, or after abortion, when and how to administer them, and what standards of care to maintain with this process. This film demonstrates good practice in administration of parental antibiotics for health workers and clearly reinforces the 6 rights of drug administration. It's now time to learn more about what parental antibiotics are and how they are administered.
Infections are often caused by a combination of both aerobic and anaerobic bacteria. It is recommended that antibiotics are selected according to which is most likely to be effective in treating these bacteria. The name parental antibiotics means antibiotics that are administered in a way other than the digestive system. Parental antibiotics can be given by intramuscular or intravenous injection or by intravenous infusion. They may be administered because the patient is unable to take oral antibiotics, because they are too ill, for instance, or because antibiotics are not available in oral form. Administering via infusion or bolus dose means that the antibiotics enter the bloodstream very quickly and become effective more quickly than if taken orally. The other advantage is that they are more likely to be given at correct intervals. Ideally, before administering any antibiotics, you should carry out skin testing for hypersensitivity to ensure that the patient is not allergic to the prescribed antibiotics. But only do this if you are not putting the patient in danger by not giving the drugs straight away. If you have an urgent situation such as septicemia, you should go ahead with antibiotics rather than a skin test. As a health worker, you must ensure that you are familiar with the medicine being administered and that it's not a known medicine to you. The medicine must be prepared in accordance with the manufacturer's instructions immediately before being administered. It's safer if the same member of staff both prepares and administers the medicine. 2 members of staff should then check the preparation and administration of the drug following the 6 rights. These are: Number 1, check you have the right drug by checking against the drug chart. Number 2, check you have the right patient by asking their name and check their notes or name band. Number 3, check you are giving the correct dose. Number 4, check you are giving it at the correct time. Number 5, check you are giving it at the correct route. Number 6, document the drug given in the patient notes. If you are prescribing and administering parenteral antibiotics, then it is essential that standards are maintained in order to minimize the risk to patient health. This means that drugs should always be stored in a secure and appropriate facilities. There should be a system for regular checking stocks of a drug so that they don't run out. The health worker should use the drug chart to prescribe the antibiotics. This is a part of a good clinical record keeping, providing written evidence that medication has been given as prescribed. When prescribing the drug, capital letters should be used to avoid the prescription being misread. Clear indication of the dose, frequency, route of administration, and duration should be given. The health worker administering the drug should clearly document the time and their initials. This is to prevent errors being made, such as the wrong drug being given or via the wrong route. After completing the drug chart, you should return to your patient. If they need antibiotics, then you should first do a sensitive test on samples of their blood or urine to check the sensitivity of the bacterium to the antibiotics. However, laboratory testing is not always available. If this is the case, then antibiotics should be selected after a doctor has made a clinical judgment on the most likely infecting organism or bacteria and the most effective antibiotics. It is possible that laboratory testing may show that a different antibiotics regime is preferable. If so, then ideally you should change the antibiotics treatment regime accordingly. Antibiotics IV bolus should be administered over 3 to 5 minutes. However, it is important to check as rates differ between drugs. Manufacturer's instructions should always be followed. If parental antibiotics are deemed most effective, then you can begin treatment. The parental antibiotics can be given slowly. Prophylactic antibiotics are used to prevent infection, for example during cesarean section when the risk of infection is increased. This protocol recommends that during cesarean section either augmentin 1.2 gram IV or sulfaxin 1.5 gram IV and metronidazole 500 microgram IV are administered after clamping the cord. However, practice varies on when the prophylactic are administered during the cesarean section, and you should ensure you follow the protocols used in your area. Women being treated with parental antibiotics are often seriously ill and could develop complications such as kidney failure or dehydration. Therefore, it's very important to maintain a careful record of fluid input and output, and this includes vomit. These records should be put onto a specific fluid balance chart. Likewise, it's important to remain alert to signs of phlebitis. Phlebitis is the inflammation of a vein and is a common complication of IV therapy. Phlebitis can follow any infusion, but is most common after continuous infusions, the following 2 to 3 days after the vein is exposed to the drug or solution. Signs and symptoms of phlebitis include swelling and redness around the puncture site, tenderness of tissue around the puncture site, a yellowish foul smell discharged from the puncture site, a sluggish flow rate. To avoid phlebitis, change the infusion site every 3 days or at first sign of inflammation. Parental antibiotics carry some risks and are more expensive to use than oral forms. So once the need for maintaining high blood level of antibiotics has passed, then the oral form can be used instead. So when administering parental antibiotics, always remember to follow the 6 rights. Administer the infusion slowly and change the site every 3 days to avoid phlebitis.
You should now have a better understanding of when, why, and how to use parenteral antibiotics. We hope you've enjoyed watching.